thought of all days, today being the 13th anniversary of 9/11, that I should take a few minutes to say that it's not all about the trials and tribulations of PPACA, and that you know, we as a nation certainly recognize the sacrifice that our young men and women have made and are still making and will be making for us. So just thought it was important to at least recognize the significance of the day. So now on to business. The FFM certification, of course, is still ongoing. We have 2 more sessions scheduled at URL, and that is on the 16th and 23rd of September. Remember that if you certified for 2014, your 2014 certification expires on 30th. So you want to make sure that you do your 2015 module training before the 30th so that the transition is seamless. Again, the 15 FFM certification will carry you through the balance of 2014 as well as you know, into 2015 until they decide to terminate that possibly at the end of 2015, just as they're doing this year. So, you know, if you've not certified, get on the ball. Time is a-wasting. Next bullet point is once again about our 12/1 early renewals. They're coming in. They're not pretty. You know, we're looking to help you with alternatives. It's very important, of course, to make sure that when you go out to your client that you talk about their current non-ACA plan, that they have the ability to keep the grandmothering provision. They also have the ability to transition to a non-ACA plan in the same family of plans that they currently have. And of course, last but certainly not least, is an ACA option. Each group is going to be different. The needs of the group, the cost of each group will be different. So please know that we are here to help you with that. Again, part of that conversation has to include, are they going to transition to individual plans, and what does that mean for, you know, cost to the employee and you know, reduction in a write-off for employers. So what does that mean? And also, you also have to talk about the ancillary or underlying products, because it's very important to, if you're raising the deductible to, you know, mitigate the cost damage, if you will, you're going to have to almost go in with an underlying plan so that the employees really are fully covered with these, pardon me, much larger deductibles. The third bullet point is about the Medicaid expansion. As we know, Healthy PA has been approved. Each carrier, or not each carrier, several carriers are going to be offering an ACA plan, metal level plan, similar, if not the same, as being offered to non-Medicaid participants. So that is, enrollment is open as of 12/1 for the people that are currently Medicaid eligible. And what that means is up to 133% of the federal poverty level. How that's going to be, how they're going to make application is yet to be seen. We do know that they can make application for a 1/1 starting on 12/1 through the Compass site, the PA Compass site, but according to the PPACA guidelines and healthcare.gov, there is a way that they can make application through healthcare.gov. We don't have those details yet. I am still in touch with the Pennsylvania Insurance Department to get more details, but quite frankly, I just don't think they have them yet. Also, there's not an answer on what's going to happen to those people that you did enroll or have enrolled that were between 100 and 133% of the FPL, because the safe harbor allowed for a subsidy to go down to 100%, pardon me, for states that have not expanded Medicaid. So of course, now that we have the 100 to 133%ers are now Medicaid eligible and no longer subsidy eligible. So again, you know, we'll work through this with you. We just don't have a lot of information at this time. The next bullet point is really based on a question that was asked last week about the 50 to 99 groups. If they don't have coverage, are they going to be penalized? And it was confirmed that if they don't have coverage, if they don't offer coverage, there's no penalty for not doing so. However, there are transition reliefs that you also have to be aware of, and I'll get into a little bit of them, but you may want to contact me to talk about your specific group relative to the transition relief, because the employer cannot willfully reduce its work size in the overall hours between February 9th of this year and December of this year in order just to qualify for the transition relief. In other words, if they are sitting at 60 employees and they reduce their workforce by termination so they can get under the 50, then they nullify their transition relief. So they can't eliminate or also materially reduce the health coverage offered to their employees as of February 9th. And the employer must also certify on a prescribed form that it meets the above 3 conditions. Now that brings us right into the last bullet point, and I will revisit the renewal and re-enrollment process in a minute, but I did want to bring your attention to a couple articles that will be in my newsletter this week. And the first one, of course, is the draft employer reporting forms. They finally have been released. The forms are in here and the instructions and details on them. We had talked about them a couple months ago when the draft was released, and who would need to complete what form and under what circumstances. So again, this is an ongoing tax issue, and the tax preparers, I'm sure, are learning or will be learning as they head into the tax preparation season about these forms. But you as consultants to your groups really do need to familiarize yourself with the forms just so that you're providing the most accurate information. The next bullet point, or the bullet point previous to the tax forms, is the renewal and re-enrollment process. Now, again, this is still a little convoluted, and this information is also going to be in my newsletter so you can review it a little bit more closely, but I'll just read a few of the bullet points because everybody is wondering what's going to happen with the current healthcare.gov FFM consumers as of 12/31. So consumers who do not denote otherwise will be re-enrolled in their current exchange plan on December 15th for a 1/1 effective date. So that's a given. Those who are re-enrolled will be able to keep their 2014 subsidy as long as their income has not changed dramatically, and if they check the box on their original application that allowed the IRS to view their tax returns for longer than a year. NAHU goes on to mention that a reported 90% of consumers did check the box allowing for the IRS to pull those tax records for longer than a year. I guess the caveat comes in when the consumer is enrolled in a plan that has been canceled on the exchange. Again, we don't have any idea what the 2015 plans will be, which will survive, which will be altered. So at this point, if a plan is canceled on the exchange, but it is offered off the exchange, then they'll automatically enroll in the plan off the exchange via healthcare.gov. I know that's kind of convoluted, and honestly, I don't believe that's going to apply to Pennsylvania because, from my understanding, every carrier is doing same on as off. So that should not apply necessarily to any of your insureds. Now, if the plan's canceled altogether, then the consumer, and this is where it gets tricky, the consumer is going to be enrolled in a plan of the same metal tier. If a similar tier plan is not available, they will be automatically enrolled in a different plan of the same carrier and metal tier. So, again, it's going to be confusing, maybe even more confusing than this year with the enrollment, but it does go on to say that if plan premiums go up, which they likely will, the consumers who are automatically re-enrolled will be on the hook for the price of that premium increase. So I would just caution you to make sure that you're gathering all your ducks, make sure that you have an accounting of all of your consumers and clients that you did help in 2014, and I would be proactive in reaching out to them and seeing you know, what they want to do. Do they want to re-enroll? Do they want to change their plan? So it is going to be labor intensive. Just, again, please know that we're here to help, and as we get closer to November 15th, I will certainly let you know what I know about the process. Also, just as an FYI, I did mention it a few times before, on October 29th, we are holding a seminar here in Harrisburg, and details will follow shortly, but it's going to be, Capital Blue Cross is going to be the topic, and essentially you're going to be reintroduced to Capital because they do want to come out of the gates this year for 2015 very aggressive and have competitive products. So hopefully you'll find that seminar helpful. It is hopefully going to give you a preview of plans that will be available on 11/15. That, again, is set for October 29th, so keep watching for those details. So at this time, that really concludes the agenda items that I have. If you are new to our our webinars and want to ask a question, you can either raise your hand using the icon on your control panel, or you can, I lost my questions. You can type in a question. So let me see if I can find my questions now. And it does not look. All right, I lost the questions. Let me see if I can get them. There we go. I can get them that way. Okay, so it does look like there's a few questions here, and I'll go through them. Again, if you have questions, you can type them in, and we'll go through them. So Jules says, if a person already has a plan which they acquired on their own without my help, and they wish to change the plan, and I help them sign up for a new plan, can I become the broker of record? Jules, my understanding is yes. Of course, you know, that would be for 1/1. So you would be going in and helping them re-enroll, change their plan, change their carrier for a 1/1 effective date. At that point, you can either add yourself to the record on the FFM. Chances are you'd have to have yourself and your client call in to the FFM in order to do that. Or you can do it on the back end through a broker of record authorization that's specific to each carrier. So my feeling is yes, if they change their plan. You know, again, it might be a bit labor intensive. And Jules says that he has a number of people that he helped sign up for the ACA, and my national producer number was entered on the app, but he's not getting paid. And he said a couple were done over the phone. What is the easiest way to be recognized and paid as the broker of record? That's definitely the BOR form, the authorization form. But Jules, if you want to work with us to get us a name list to include social and date of birth, we can go back to the carriers and certainly mention the carrier. Go back to the carriers and see, you know, if they have record of the app, first of all, and if they have record of you being hooked into that app. So we'll help you with that. Federal poverty level, you know, for 2014, the FPL is as little as a family of one down to $11,490. That's 100% of the FPL. Or for a family of four, I believe it's $92,000 some odd dollars. 2015 will be different, so I do not have that. Daniel says, please define PPACA. It is the Patient Protection and Affordable Care Act. That's just an acronym for the law. And you hear it referred to as, of course, Obamacare or the ACA or the Affordable Care Act. It's all the same thing. It is this law that we are obligated to sell within the guidelines of this year and for many in the future. And Daniel, I will make sure that you get the newsletter and on the list of the newsletter. Steve says, did you say that was tentatively October 29th for the Capital Blue Cross seminar? No, it is definitely October 29th from 9 to 11. So that is the date. It's going to be at the former Colonial Country Club on Lincolnstown Road. So I will, again, get more information on that. The invitation will be going out shortly. Ed says, just making sure I heard you right. If premiums go up for 2015 insurance plans, the subsidy is going to remain the same. That's what I'm hearing. You know, again, Ed, you know, the subsidy they said could remain the same if the income is the same, relatively the same. So, you know, I guess we're all going to find out together how that's really going to work in live time once that process is truly released, but I'll try to get additional information on that for you, Ed. And at this point, that it looks like it concludes the questions that we have. And just a reminder that we do hold these webinars weekly. The next webinar is Thursday, September 18th. They are always at 9:30. As you can see, they don't last more than a half an hour typically, and hopefully, again, it's a way that we can all learn together and keep abreast of all of these rapid changes, rapid fire changes of the law and the new regulations coming out to support the law. So again, I thank you for your time, and hopefully you have a great day and a great week and a great weekend. Thank you very much. Bye-bye.